Your face hurts, your nose is completely blocked, and every time you bend over, the pressure in your head gets worse. That is what a sinus infection feels like, and it is one of the most common reasons people reach out to a doctor. So let's talk about what is actually happening in your body and what you can do about it. Your sinuses are small, air-filled spaces behind your forehead, cheeks, nose, and eyes. They help filter and humidify the air you breathe. When the lining of those spaces gets inflamed, mucus gets trapped inside. Bacteria, viruses, or even fungi can grow in that trapped mucus. Doctors call this sinusitis, the medical term for a sinus infection. Most sinus infections are acute, meaning short-term, usually less than 4 weeks. Chronic sinusitis lasts 12 weeks or more and can seriously affect your quality of life if it goes untreated. Here's something important to understand. The vast majority of sinus infections are viral, meaning antibiotics will not help. The CDC is clear on this. Viral sinus infections usually clear up on their own within 7 to 10 days. Bacterial sinus infections are less common, but they do require a different approach to treatment. The most common cause of a sinus infection is a cold. When a cold causes swelling in your nasal passages, your sinuses can get blocked, mucus builds up, and bacteria can move in. That is why so many sinus infections feel like a cold that just will not quit. Allergies, a deviated septum, nasal polyps, dry air, smoke, and even changes in air pressure from flying can all raise your risk. People with asthma or a weakened immune system are also more likely to deal with sinus infections. The symptoms overlap a lot with a cold: stuffy nose, headache, fatigue. But sinus infections often come with facial pain or pressure around the cheeks, eyes, or forehead. Thick, discolored mucus, yellow or green, draining from your nose or down the back of your throat is another common sign. Some people notice tooth pain in the upper jaw, reduced sense of smell, or a cough that gets worse at night. A big red flag: cold symptoms that start to improve and then suddenly get worse. That pattern, or symptoms lasting more than 10 days with no improvement, is a reason to talk to a provider, and some symptoms need immediate attention. Very high fever, stiff neck, vision changes, or swelling around the eyes, those are emergency-level symptoms. Get to an emergency room or call 911. For most viral cases, home care goes a long way. Drink plenty of fluids, use a saline nasal rinse, inhale steam, run a humidifier, rest. A warm compress on your face can ease the pressure. If a provider determines your infection is bacterial, they may recommend a prescription. That decision depends on your specific symptoms and clinical picture. It is not one size fits all. SendClinic offers video and phone visits with licensed providers who can evaluate your symptoms without a waiting room. Check SendClinic.com to see what is available in your area. If symptoms are dragging past 10 days or getting worse instead of better, do not wait. Early evaluation is how you avoid a short infection turning into a long one.